Podiatrists and diabetes. Why do I need to see a podiatrist?
Podiatrist. Diabetes.
Do you know what a podiatrist is?
Why do they say podiatrist? What's that?
Eh?
Eh?
Yes, that is what I get all the time. Health disparities in diabetes amongst people of color is real. So when diabetes advocate and influencer Dr. Phyllisa Deroze invited me onto her platform to talk about podiatrists and diabetes, I had to say yes. And in this video, I'll be sharing that with you.
Okay, everyone. So I'm really excited to introduce you to Dee. I like to call her Dr. D because, we got to put some respect on these names. And she is a registered podiatrist. And we are going to talk about feet. As a person living with diabetes, I've often heard that I needed to see a podiatrist, but I didn't know at what point. So we have 10 questions from people who have decided that they want to tune in and ask you questions. So our first question is, tell us simply, what does a podiatrist do?
Yes. So first, I just want to say thank you so much for inviting me to speak with your audience. And just a disclaimer, guys, this is all an information purpose only. So if you wanted to take any of my advice, make sure you speak to your healthcare provider first. And so podiatrist, really good question because we often get asked this a lot, especially with orthopedic surgery. So orthopedics is, surgery of the bone, and their focus is 90% of the time geared towards some sort of surgery. Whereas a podiatrist, although both professions treat, the same conditions of the foot and ankle, we focus mainly on, but not limited to, like diabetic foot care, general foot care, footwear advice, wound care, but surgery is always the last option for us.
Oh, okay. So foot and ankle and surgery is okay. So thank you very much for that. Everyone, podiatrist, foot and ankle, right?
Yeah.
Wound care, routine care. So routine care, that brings me to our next question. Why is it important for people with diabetes to see a podiatrist?
Yeah, so one of the most common and feared complication is neuropathy. So that's losing the sensation in your fingertips and your feet. And once you lose that sensation, it puts you at risk of many, many different complications. So that's why, podiatrist has special tools and equipment to, assess your sensation for you as you go along. Because if your sugar levels are not being controlled for, a long time, it really, really affects your sensation. So you really want to keep that under control. And yeah, losing your sensation, like I said, is just causes for a lot of complication.
Okay. Now, if you're losing your sensation, can you get it back? Can you regain sensation?
The whole idea is to kind of slow it down, but once it sets in, then it becomes a case of if you get to that stage where the neuropathy starts being painful, it becomes a case of just managing the pain. So no, you can't reverse it at all.
Oh, okay. Now, we did have a question about neuropathy. The question was, what are some good natural treatments for diabetic arthritis and or diabetic neuropathy? And I have to say, I don't know what diabetic arthritis is, so maybe you can answer that. I'm familiar with neuropathy.
Yeah, so there's nothing specific to diabetic neuropathy per se. Arthritis is just an umbrella term for the many forms of arthritis that can affect the feet or your body. So I just want to say as well, not because something is natural means that it's okay, and you'll see why in a moment. So like I said, people with type 1, it's an autoimmune. So you can also have some forms of arthritis do affect your autoimmune system as well, for like rheumatoid arthritis. So it's really important that you get that diagnosed by your healthcare provider preferably, you know, a rheumatologist. And there are many, many different things that you can take, you know, supplements wise for arthritis, but like say, speak to someone first. For like in my family, yes, we have a lot of arthritis going on. So we do take, you know, garlic, ginger, and turmeric. Now, there are evidence to suggest that turmeric is really good for, you know, helping with arthritic pain and inflammation. But there's just not enough evidence out there for me to go and say, oh yeah, take it. And also, turmeric is like a blood thinner. So if you're taking warfarin or aspirin or any sort of blood thinner, you can't take turmeric. So although it's natural, you still have to be very, very careful. In terms of, oh, and I will say, I've had patients actually come back and say to me that, yes, you know, the turmeric has helped. And yes, it is working in my family. But again, speak to your provider before you start taking it.
Okay.
In terms of neuropathy, there isn't anything natural, I could say. Again, once the neuropathy really sets in, there are specific medication that your healthcare provider can provide for you. So it's a case of where you are right now, making sure you're controlling your sugar levels and seeing a podiatrist to kind of slow down yourself getting neuropathy.
Oh, okay. Well, thank
I
you
hope
for
that answers
that.
that person's question.
Yeah,
Yeah.
it does. You know, a lot of us will have, you know, ginger tea, garlic around the neck, some Vicks, you know what I'm saying? We go all
Yes.
so. Other question we had is, should people with diabetes see a podiatrist even if they don't have any foot issues? Like they are healthy, A1C is good, time in range is good, you know, their toes are nice, they're not losing
Yeah.
sensation. Do they still need to see a podiatrist?
Let me say, there's guidelines out there actually that says, you know, people with type 2 at the time of diagnosis, you do go and see a podiatrist. And if you're type 1, you go 5 years later. But they're just guidelines. But personally, I think everyone should see a podiatrist straight away, even if they don't refer you, ask for it. Just simply because once you go and see that podiatrist, they will put you into a risk category. So, you know, low risk, if you can, no sensation loss, no foot deformity, no callus, everything's good, then you're low risk. Then you move up into medium risk if you have some callus on your foot. And then you go up to higher risk if you've got a bit of loss of sensation, a bit of callus. And then you go into extreme high risk if you've got all those plus some sort of deformity, so like a bunion. So yeah, even if you don't have any issues whatsoever, it's still good to go because anything can change. At least once a year, go and see a podiatrist and get a diabetic foot assessment.
Oh, okay. That is good information. So you should know your level of risk. I had people with flat feet are just going to have pain because that's what I was told. So I was like, oh, I got flat feet. I guess I'm going to be in foot pain.
No, that is so not true. I mean, look, you have normal arch. Not all of us have an arch. You know, when you're born, our foot is completely flat. And as we develop, yes, you might get a bit of an arch or you may not. And just remember that we're on our feet all the time. It's the strongest part of the body. So if your feet is in pain, you need to go and see someone. It's telling you something. So no, it's not normal to have pain in your foot, flat or non-flat, because any foot type has its own problems associated with it.
Got you. What is Charcot?
Charcot foot. It's one of the most common misdiagnosed complication of the foot. So that's a very, very good question if you actually know about it. So Charcot foot is a progressive injury to the foot. So basically what happens, the bones in the foot either dislocate, fracture, or totally collapse or break, sorry. So the classic signs and symptoms are, you know, one foot is normally bigger than the other. One foot is also warmer than the other. and then there might be some sort of deformity as well. But because it happens mostly to those with, neuropathy, and, once you have neuropathy, you can't feel, it, that's why it's always so misdiagnosed. Treatment is quite long. There's like 3 different phases for it. So if you're seeing a podiatrist regular and this is happening, it's really important that they spot this early so that they can start treatment immediately. Because the biggest thing that happens is the deformity. Your feet actually ends up looking like this, so a rocker bottom foot. And once the deformity sets in, it can't be reversed. All they can do then is just, fix the bones, and then you wait maybe a year or 2 for that to all heal, but that deformity stays, and with that deformity, you're at risk of ulceration.
Oh, okay. Well, thank you for letting us know of that. Like, what would be an early sign? You said the one foot would be bigger than the other, or warmer. Like, what should
Yeah, warmer than the other and bigger. So yeah, your podiatrist should be able to pick that up for you as well. But yes, just as long as you're paying attention, checking your feet daily, and you notice something is not right with your foot, then go and see someone.
Okay. All right. Daily care. So that brings me to clipping toenails. So who should be clipping my toenails? Me, a podiatrist, or my Vietnamese manicure, pedicure lady? Like, who's responsible for clipping my toenails?
I'm quite biased. Someone might shoot me in the foot for saying this, but I am so not into the whole salon things. Simply because being a diabetic, you're already at risk of so many complications. You're definitely at risk of, fungal infection. So that's, discoloration of your toenails. With nail bars, you don't know their infection control regime. You don't know if they're sterilizing their instruments. You don't know if they are also, using a fresh set of instruments for every client that comes to the door. They're not trained to cut toenails. They don't, the correct way. They also don't know how many skin to remove. I see a lot of them taking away, a lot of the skin around your cuticles. They're there for a reason, is to stop, infection bacteria getting in. So you can't really be taking off too many of that. So in terms of who should be cutting your toenails, definitely not a spa. Stick to a podiatrist. It might cost you a lot more money, but you'll be safer. And also, they put the same nail polish onto your foot. So I might come in, I have a fungus on my toenails. They won't be able to identify that. They put the polish on me, then they go and put it on you. And then you're at risk of getting that. So, I mean, podiatry now, like I said, there's so much aspect in podiatry that they can do for you. A lot of them now are also bringing in their own nail polish. So you'll be able to buy the polish, and then the polish is specific to you. So you'll always have the one polish for yourself. And then the polish that the podiatrists use, it has antifungal properties in there as well. So it's not the rubbish stuff that the spa put on your toenails.
Okay. Okay.
Yes.
No.
Very careful with your toenails, and that's one of the things that a lot of patients come through for a podiatrist for is ingrowing toenails caused from spas. So cutting nails should be straight across, but they tend to go down the sides and stuff. So you want to be extra careful.
Oh, okay. All right. Thank you very much. What advice do you have for people generally who are living with diabetes in terms of like foot care? Like, what should we look for? How should we treat our feet? Just general comments that you would say to anyone living with diabetes about their feet.
Yes, very good question as well, because a lot of people don't know how to self-care their own feet at home. So I would say, check your feet daily. It's the furthest thing from the body and it doesn't get any attention. Check them. Just a quick glance, you know what they look like. Check between the toes. Look for cracks, any breaks in the skin, any moisture. You want to make sure that's all being absorbed. If you can't do it yourself, get someone to do it for you, or use a mirror even. go and see a podiatrist or get, your doctor, your GP to assess your feet at least once a year. Check your footwear as well. Make sure you're wearing really good footwear, nothing too flexible. No barefoot walking, even if you have carpet in your house, because again, you're at risk of piercing. You don't know if you have a little bit of sensation loss or anything. So always have something on your feet. Moisturize your feet as well, especially in the winter months, being cold and stuff. Moisturize, just a really good, simple, vitamin E cream that's specific for the feet. Yes, the normal body cream won't penetrate on the sole because the sole has 5 layers. So it's very different. So get something specific. And then when you go and see, the podiatrist, if you've got something more, then they can specify something more specific for your whatever you got on your feet that needs treating.
Okay, awesome. So we have some questions in the chat, which is really exciting. And one is about an ingrowing toenail. So if you already have ingrowing toenails, like, who should cut your toenails?
Stick with the podiatrist, yes, because you don't always need nail surgery. They can manage your ingrowing toenails conservatively.
Okay, awesome. And then how often should someone with diabetes see a podiatrist? Is it annually? Is like how often?
Yeah, so if you have no complications whatsoever and you're really adamant that you want to self-care your own feet, then go at least once a year. If you've got, hard skin and stuff under the sole, then at least 6 to 8 weeks. It just depends on their schedule.
Okay.
I always say to my patients, or even to you guys, it's so much easier to live without a pair of teeth than to live without your feet. So really look after them. Barefoot walking, why would you want to walk around barefoot?
You make me want to bring a dentist on now, because they might say it's easier to live with bare feet than without your teeth or something. All right.
True.
Well, thank you very much for this. Is there anything that you want to say that you didn't get an opportunity to say, to let us know, because our time is wrapping up for this live?
Yes, really invest in your podiatrist. Do your research. I'm not bashing anyone out there at all, because not all podiatrists, care about their patients. You're just another dollar coming into the door. And really make sure, especially because you're living with diabetes, make sure they're doing, a good diabetic foot assessment. Don't let them just take off your socks and shoes and look and say everything is okay, because it's not just about the neuropathy. A podiatrist can pick up so many things. I have spotted melanomas, embolisms. There's so much that a podiatrist can pick up that others won't. So really invest in your podiatrist.
Okay, thank you very much for that.
All right, I hope you got major value from that interview. And if you haven't seen a podiatrist, we'll take action and see one as soon as possible. And if you like that video, go ahead and like and subscribe to the channel. And I'll see you on the next one. Take care.